Occupational therapy is about 100 years old. I feel like a lot has changed since that time.
I don't know. Have you seen the Centennial Vision? It's very similar to the Founding Vision, which was written in 1917 at the Founders Meeting. This was when the AOTA was still called the NSPOT, the National Society for the Promotion of Occupational Therapy.
The particular objects for which the corporation is formed are as follows: the advancement of occupation as a therapeutic measure, for the study of the effect of occupation upon the human being, and for the scientific dispensation of this knowledge.
And then the Centennial Vision, which was written in 2007, states,
We envision that occupational therapy is a powerful, widely recognized, science-driven, and evidence-based profession with a globally connected and diverse workforce meeting society's occupational needs.
It seems that both statements promote advocating for the profession of occupational therapy with the aid of scientific evidence that demonstrates its therapeutic effects.
And there are a lot of aspects of OT today that were both introduced and advocated for by two of OT's founders, Eleanor Clarke Slagle and Dr. Herbert. For example, both of them really pushed for the use of evidence-based practice. The practice of occupational therapy needs research in order to make it a valuable, long-lasting profession.
I agree. When I was president of the National Society for the Promotion of Occupational Therapy in the early 1920s, I pushed for the necessity of demonstrating effectiveness through research. You can't just tell people occupational therapy works, you need to prove it. We need to find a way, through recording progress, to demonstrate the valuable therapeutic effects of occupational therapy.
I agree. I also pushed for the New York Mental Hygiene Department to participate in occupational therapy research in addition to psychiatric research. I believe that this research would help validate the therapeutic effects of occupational therapy on this population.
In 1905, I published the findings of a study I did through Harvard University, which showed the positive effects of arts and crafts on stress.
Evidence-based practice is still a very important aspect of OT today. There are currently many emerging practice areas of OT that need evidence-based practice in order to verify the therapeutic value of OT in those emerging practice areas.
We also need to continue to use evidence to demonstrate the effectiveness and efficiency of OT in established areas of practice, so we continue to use the best methods possible. Besides evidence-based practice, both Hall and Slagle looked at grading activities according to the level of the patient as a key component of the practice of OT.
I found that at the handcraft workshop, it was very important to grade the complexity level of an activity to the appropriate level for the patient. By adapting the activities, it prevents patients from getting too tired or frustrated.
Therapeutic activities need to start out simple, and when the patient is ready, we will present new activities that are more difficult and require more attention. The increased complexity will also increase patients' interest in the activity.
We start out with simple tasks, and once the patient is proficient in completing those tasks, they will move on to tasks that require more coordination. At the highest level, the patient will weave on the loom, which requires hands and feet to work together.
Just as children's schooling is graded to their level of comprehension and knowledge, we grade our re-education programs to our patients' abilities.
Grading activities for therapeutic use is a widely used practice in OT today. Many treatment plans incorporate grading as an effective means to get a patient from a low-level functioning in an activity to being able to perform the activity independently.
It's so interesting that both Slagle and Hall were pioneers in using grading in practice. And if I remember correctly, Slagle and Hall both took a holistic view to therapy, which differed from the medical model that was very popular during their time. Using occupation as a therapeutic technique alters the habits of the patients. It helps develop new and beneficial habits that return the patient to and maintain well-being.
The handcraft workshop did more than just cure a patient's illness. It also provided the patients with the skills necessary to participate in meaningful employment.
Occupational therapy must address all aspects of the patient. It must strive to improve mental, physical, and social abilities where necessary.
I agree. The patient also needs to develop these skills in multiple contexts.
A big thing that separates OT from other medical professions today is that OTs look at the individual as a whole when developing a treatment plan and looking at what occupations are meaningful to them. Many other professions focus on the specific body part or aspect of the individual that's affected when treating. It's interesting to see that Hall and Slagle helped integrate the holistic model into the practice of OT.
So not only are the two visions similar, but many OT practices and beliefs that are used today are a continuation of those introduced by some of our founders.
Wow, I never realized how many similarities there are between the practice of OT in the time of the founding vision and present day when the Centennial Vision was created. I also never knew that Eleanor, Clarke, Slagle, and Dr. Herbert Hall played such an influential role in pioneering the practice of OT.